Pneumonia begins the moment a pathogen enters the lower respiratory tract and bypasses the body's defense barriers. Under normal conditions, the cilia, mucus, and resident macrophages stop most invaders. But when a microorganism is strong enough or the immune system is weak, the pathogen reaches the delicate alveoli. Once inside, it starts multiplying rapidly, releasing toxins and triggering an immediate inflammatory alarm. The immune system responds by sending neutrophils, macrophages, and inflammatory mediators to the site of infection. As these cells flood the alveoli, capillaries around them become more permeable, allowing fluid proteins and immune cells to leak directly into the air sacs. This is the turning point where gas exchange begins to fail. The alveoli, which are supposed to stay dry and open for oxygen to pass into the blood, become heavy, water-filled chambers that collapse or get clogged with exudate. As more alveoli fill with this thick inflammatory fluid, the lungs lose their ability to expand normally, and the patient starts developing tachypnea in an attempt to compensate. Despite breathing faster, oxygen cannot cross the flooded alveoli, leading to ventilation-perfusion mismatch. Blood flows normally through lung capillaries, but the airspace receiving that blood is blocked. This causes oxygen levels to fall and carbon dioxide to build up, creating a dangerous imbalance. As consolidation spreads across lung segments, the stiffness of the lung tissue increases, making every breath more difficult. The body continues to fight, but the inflammatory process itself becomes part of the problem. Patients may begin to show signs of hypoxemia, altered mental status, cyanosis, or increasing work of breathing. In severe cases, the infection may spill into the bloodstream, causing systemic inflammatory response and potentially sepsis. Without timely intervention, the oxygen deficit and inflammatory overload can lead to respiratory failure. Understanding this sequence from pathogen entry to alveolar flooding, consolidation, ventilation, perfusion, mismatch, and hypoxemia helps clinicians predict deterioration early and act with precision. Pneumonia is not just an infection. It is a physiological chain reaction unfolding inside the lungs. And every step of that reaction determines how quickly the patient recovers or declines.